here who works for the AIDS Healthcare Foundation.
Thanks for having me.
Of course, my love. So we're just going to be talking a little bit about sex, myths and facts about it, and just opening up people's minds and brains of things that you may not even know about sex.
Correct.
Because we all sometimes
if you're not having it, you're thinking about it, or you're planning on it. So
exactly.
let's find out some facts.
Yes. Okay, so what is the AIDS Healthcare Foundation?
So the AIDS Healthcare Foundation is a nonprofit organization that started in 1987. It started originally in hospice, and then we expanded as the years went on. It's a nonprofit organization. So, the CEO of the company, he started from the ground and basically made his way throughout the years. He had a lot of, people close to him that he actually seen pass away from the virus. And back in 1987, the virus was just being exposed, so people didn't know what it was, or medications to take, or anything like that. So 30-something years later, look at where we are now. We have about over 900,000 patients in care.
Wow.
And we're global.
And it's the largest one, right?
We're the largest nonprofit organization for HIV and AIDS and STDs, and we're in 39 countries.
Wow, that's great.
I know, it's an amazing thing. I mean, when you see the documentaries or different things from when he started until now, it's you literally stay with your mouth open, and just to be a part of this amazing thing that's changing the world, and it can happen to anybody. I mean, it feels great to be a part of a mission and to be a part of a life-changing experience that can happen to anybody.
And you mentioned documentaries. What are some of documentaries that
if you go on YouTube, or if you just look up if you even go on our website at the AIDShealthcare.org, there's videos and stuff from when we started in 1987. I mean, stigma, different things that we had to advocate for that we still do to this day, but just different things that you can see the mission from the bottom all the way till now. And then when you see it, it's really rewarding, and it really gets emotional when you actually see it, because it's wow, the things that people really had to deal with a virus that can happen to anybody. I mean, people thought this could only happen to men, and it was just if you had sex with men, MSM, which is men who have sex with men, that it was only for them.
Yeah.
Or it can and it can happen to anyone. But if you see where people's mind frames were back then, and the things that we as a company overcame with even the doors shut in our face, and we were no, we're still breaking down those barriers, because this is something that can happen, and we're going to show you that it can happen. And when you see all of those, it's wow, look at what they, what they accomplished, and look at what they continue to accomplish. And it takes a village to raise a child, as they say, and it takes a village to help one another out in any circumstances. Sure. So it feels good.
So how did you get involved in working for this company?
So I started off as a medical relations coordinator at the Community Blood Centers of South Florida. Okay. And that's where I got my certification back in 2008. So I've been in the field for about 10 years. I did get out of it for about 2 years. And then I felt this is what my passion was. This is what I really like to do. Communicate with people, advocate, educate, motivate, and because back 5-6 years ago, we were small here in South Florida still. Yeah. So, now you drive around, you see us, our bus benches, our billboards is everywhere. But before, 6 years ago, it was kind of who, where am I go? So I worked at Imperial Point Hospital, and we still have a healthcare center there. However, from 5 to 7, we would do free HIV and STD testing. And I actually went there with a group of friends and stuff like that to get tested. And I was just kind of curious, oh, so what do you guys do? And, you're only here from 5 to 7, so on and so forth. And then...
It was great hours.
Yeah. So I got out of my other job kind of early. So it was still I still had some free time. So it was let me just get into it, see, what it's about. And I actually started off as per diem, only on Mondays and Thursdays from 5 to 7. Okay. That was it. And I got my hands and my feet wet back in the ocean, as they would say. And I just felt this is my passion. This is what I want to do. So of course you can't afford living off of a per damn check.
Yeah.
So I mean, I did both. I worked at the hospital.
Yeah.
So I did both. I worked at the hospital, and I still did this part time or per diem whenever they needed me. And then I just wanted to learn, and Samantha, can you help us with this? Of course. Samantha, do you want to learn this? Of course. Do you want to get certified for this? Of course. So it was kind of like I got my feet wet again. I started to swim until I took over. I was just like, I'm taking over this ocean.
You are breathing the water.
Exactly. So then I went ahead and I wind up getting a full-time position because they had one opening because we were getting bigger and we were seeing more clients and different stuff like that. So I applied and I got the position. So that was like, yay, I was excited. And then, we moved on from there. I wound up leaving the hospital in good terms, of course. And I just, focused on the AIDS Healthcare Foundation and helping the community and just advocating and, like I said, educating. And I'm just talking to you, we're having this one-on-one, but I mean, I would sit there and just be hanging out with friends and just be like, did you get tested? Do you know your status? Do you know this? And they'll be like, what? And some people are kind of like, girl, what are we talking about that for? And like, did you have the facts? What you mean?
It's true.
Yeah. So, I mean, that's how I got into it all over again. I don't plan on leaving it. I feel like I wake up for this. Like, working is not really like a job to me. It's kind of like, I wake up and I do what I love. Like that saying, like when you, what is it? Like if you find something that you love, you're never working. So it's kind of like I'm never really working. Even though I am working, it's kind of like I love what I do. So it's kind of like I'm always thinking about ideas or different things. So I love it.
So you love it in general, but what's like the most like gratifying thing about your job?
Being a part of the mission. Just knowing that you're not in this alone, that, I mean, if you don't take care of yourself, that possibly it can happen to you, and just knowing that you have a huge, amazing team behind you. And there's some people out there that don't even know that to this day, that they're not even in care anymore, or they never got into care because of stigma, or because they're scared, or because they're afraid of what somebody's going to say, or it's just learning that once again, this can happen to anybody, whether you have 100 sex partners or you may just have one sex partner. It can happen to anyone. And I mean, not only through sex, but other barriers as well. I mean, if you're an IV drug user, different things like that.
Yeah.
But at the end of the day, it's just being a part of the mission and knowing that you have this whole team that is, our main goal is to take over and to get everyone that is HIV positive in care, or if you are not HIV positive and you're negative, to remain negative. And we're going to show you and teach you how to basically protect yourself and make sure that you educate other people once we inform you with that information.
That's beautiful, because even like you have a conversation with one person, but then you enlighten that person, and now I can like go to my friends and be like, look, this is what I learned, or this is what I saw.
Exactly.
And then it's like a trickle effect.
And that's what we want.
Yeah, because some people like, they're like, oh, I want to do more and more, but like you don't realize how much you could do with just helping and informing one person.
Exactly. And then giving them information. And there's some people that come in and they're like, oh, excuse me, they're like, oh, I'm not here for it for me, I'm here with my friend. Even though they may be there because they're curious, but they just don't want to say it, I provide them, I overload them with the palm cards.
You treat them the same.
Yeah, just like, because it's like you may not be here today for yourself, but tomorrow or the next day you may feel like I want to know my status, or I found the courage and I have all of the information to go. And we make everyone feel comfortable. I mean, it's already people already get butterflies in their stomach when they're going to go get an HIV test or even STD testing. They're like, oh my goodness. Even though you know what you're doing, but it's still like a nerve-wracking experience. So we try to make everyone feel as welcoming as possible when they come in. Hi, how are you? It's not kind of like, hi, how are you? Like you're going into an STD clinic, oh my goodness, you have like how many sexual partners? Because people think that, like, like they have that mindset like, oh, if I go to an STD clinic to get tested, people are automatically going to judge me or something like that.
Especially like women, like if they have a large amount of
whatever
that is,
exactly.
sex partners.
So, I mean, we let people know that, of course, we're a non-judgmental, environment. And we're just there to help and to treat and to educate. So it's like, welcome, come on in. So it feels good when we make people feel good, and when they come back, or they come back with a friend, like, I'm gonna come back, I'll be right back. And, and then they come back the next day or a couple hours later with like a group of friends, and they're like, I told everyone, now they're here. So it makes you feel good because, I mean, you're educating people, but you're making it a fun experience for them as well. So that they do bring people back, and that they come back themselves to find out their status in another 3 months or another 6 months, that they keep up with their status. Because of course, you know, you get busy in your day-to-day life and doing things that we all, of course, have intercourse and different things like that, but when it comes when it comes to actually knowing your status, I mean, you can ask certain people, like, do you know your status, do you know your status, and maybe only 3 people may raise their hand out of 10, then you know it, and the rest are kind of like, oh, that's a good question. But are you having sex? Yes. So I mean, it's always good to just know your status and just go in. I mean, it's a quick test, it's a rapid test, so you find out before you leave the actual center. And if you get, you know, you test negative, we provide you with information on what you can do to remain safe and different stuff like that. And if your results come back, let's say reactive, for the
and that's
HIV.
Positive. That means positive?
We don't like to say positive because it's a rapid test, so it's kind of like that can be a false, you know, a false reactive or a false positive. Because I mean, we're only those tests are only searching for the antibodies. Of whatever we're testing for. So that's testing for HIV. So it's only checking for the antibodies of the virus. So if you don't have the antibodies, it's going to come back negative. However, some things can trigger the test, like if maybe you're pregnant or if you're under medication. There's been cases where it does provide a positive result. However, you're HIV negative.
Wow.
So, I mean, after that time when we do a rapid test, if your result comes back reactive, then we do a second test with blood to basically confirm if those results are, you know, correct or it's going to be a false positive. I mean, it's a small percentage of cases that we've had that have come up false positive. However, it's a possibility that that can happen, and we inform everybody when they do test reactive, like, okay, well, we're going to do a second test to confirm these results, because anything can be a false, you know, false positive and so on and so forth. And we have our linkage coordinators that basically help our clients basically hand in hand to actually get into care. So they'll go with them to their first appointment. If they don't have transportation, they'll find them transportation. So it's not kind of like,
you're not on your own.
Exactly. Like, oh, well, these are your results. Have a good day. It's
and then, like, who wants to go, like, tell your mom or a family member, even a friend, if you do come out positive?
Yeah,
like,
that's
the stigma that you deal with because of that. So it helps to have someone who knows what they're doing that you can talk to and just get things initiated. Yeah, because there's people that are like, they don't tell their families or friends or anything for years until they feel comfortable within themselves. And we inform, you know, everyone, like, this is your health care and this is, you know, your information. You don't have to disclose this information to your mom, to your, you know, to your family members, to your friends, you know, but we do inform them. However, if you're gonna have intercourse with someone else, then you do have to disclose your status. You know, it's only right. That's the law.
And it is the law. Correct. So we inform them on that, but they don't have to go broadcasting it. But, you know, at a time, sometimes it takes 10 years until they feel comfortable to disclose their status. But they do get to that point where they feel comfortable within their own skin. But at times, people still are in that stage of denial, which is kind of like, I know I have the virus. I know that I'm taking my medication, and I know that I'm in care, but do I really have the virus? You know, so it's kind of like they go back and forth. Correct. So if they don't accept it, how are they going to be able to tell someone and expect them to expect it? Or especially if you tell someone, they may have questions. And questions that they may not be able even to answer or feel comfortable answering. So, I mean, you have to feel comfortable. Even more. Yeah. So, I mean, you have to feel comfortable within yourself before you're able to disclose those things.
And you were talking about getting tested like 3 months, 6 months. Like, how often should a person who's sexually active get tested?
For HIV or STDs?
For both.
So for HIV, if there's a window period, which is 90 days. So let's say if you have, I'm going to use an example, let's say if you have intercourse last night or even a month ago and it was unprotected. And you may be like, oh my goodness, what's going on? I don't know, I'm scared. Oh, you know, all of that. If you was to go get an HIV rapid test, it's not going to show up on that test. You have to wait 90 days from the time that actual incident happened. It can come up before 90 days. However, you can't completely, like...
It's more accurate.
Correct. You can't sit there and be like, oh, I'm not going to, you know, after oh, it's negative, then I'm okay. No, after the 90th day or the 90th day, if you do your test, then that's your results from that time that incident happened.
Okay.
So I would say every 3 months for HIV.
Uh-huh.
And then for STDs, it all depends on, what your sexual habits are. I mean, if you're, sexually active and you're having sexual intercourse with multiple partners, then I would suggest every 3 months as well.
Okay.
If not, then every 6 months. And if you're only having maybe one sexual partner where you feel like, oh, I'm only having intercourse with one sexual partner, I mean, you can feel like the relationship or you and that, partner can be monogamous. However, that may not be.
Know.
Exactly, girl. So at that point, you want to go ahead and at least get tested every year.
Okay.
So when you do your actual physical exams at your primary doctor, inform them that you want to get tested for HIV and STDs. I mean, sometimes you would think, because some people are like, oh, I went to the doctor and they tested me for everything. But when they test you for everything, they may test you for like your red blood cells, your white blood cells, different things like that, but they're not checking for chlamydia, gonorrhea, syphilis, HIV, herpes.
So to specify.
Correct. You want to basically inform them like, I want to get tested for X, Y, Z, A, B. You want to tell them everything so that they're aware. And sometimes the doctors may ask you, and that's why some people get timid to ask the physician, like, I want to get an HIV test, or I want you to check me for STDs, because sometimes they're like, why do you want to get checked for that? Is something going on? Yeah, and I mean, it's horrible for you to think a doctor would say why.
Yeah.
But there's physicians that are like, why? Are you sure you want to get? Are you in like? You're not even high risk or this
or that? I feel like it shouldn't even be questions. Correct. I feel like, oh, this is what you want. I got
problem.
You.
Exactly. That's how it should be.
Yeah.
But there's some doctors. So at that time, sometimes people are like, oh no, forget about it, I don't need it. But in reality, it's like they do need it, and you questioning them is making them feel like they're being judged, so they don't want to do it. But it's always good to get it done, and I mean, it goes a part of, your physical exam if you do choose to get it, so it's not like, well, part of most of insurance, it goes with everything, so it's not like you have to ask, like, oh, I have to pay an additional price for that, or anything like that. It goes hand in hand with your blood work.
Oh, okay.
And even when you do like pap smears for females, when you go ahead and when you go to your OBGYN on a yearly basis to do your pap smear, tell the doctor, I want to get tested for HPV, I want to get tested for chlamydia, gonorrhea, BV, which is bacterial vaginosis. Check me for those things. I want to make sure that I'm okay, because when they're checking, they're not checking for. When they swab, they're only checking for abnormal cells. They're not checking for specific. Correct. Test. So then that's why they say, we'll call you if anything's abnormal with your pap smear. And then if everything's normal, sometimes they say that you don't call or whatever. But it's always good just to tell them you want those extra tests, because if they're already down there doing their shebang bang, you might as well do a couple more swabs to test you for everything else. True. And I mean, most of the time, if anything comes up, most STDs are curable, like chlamydia, gonorrhea, syphilis. Those things are curable STDs. It can go away, but some things like HIV don't go away. But if you can get tested to make sure that, you're okay and someone else that you're having intercourse with is okay, then why not?
That's true. So what's the hardest part about your job?
The hardest part, I wouldn't say it's the hardest part, because it's not hard because you're helping an individual. However, when you have to disclose that status that you're telling someone your HIV, your test has come up reactive on our test. Those little words right there may sound so small and like it's not even a full sentence, but that is just changing someone's whole world around. And sometimes people are uneducated about the virus, so they feel like, oh my God, I'm going to die tomorrow, or I'm going to walk out of here. So that's the hardest thing, and especially when people don't have any support, like at home, or they may be homeless and they don't have a place to go, or, any type of source of income, or any type of source of getting food, or maybe making it to the healthcare centers to get their medication. And even though we provide those services, it's still kind of heartbreaking.
That initial moment when they don't think they have.
Correct. It's difficult, and even though you try to explain to them at that moment, like, we have your back 100%, we're going to take care of you, we're going to make sure that you get your care, but you have to do your part too. We can only do so much, and the other person has to do the other 50%, or so to, you know, take responsibility for their own health care.
Yeah.
But at the end of the day, you know, sometimes you try to, you know, let them know that we have their back 50%. We just need them to do X, Y, Z. And sometimes it's difficult for them because some people are, like I said, they're homeless. They're under the influence of narcotics and alcohol. So sometimes those clients, they leave, and then we try to get in touch with them, and since they're under different, you know, narcotics and different stuff, or just life itself, sometimes, I mean, it gets the hold of them, and sometimes we lose those clients. And, you know, we have our departments, and we have the Florida Department of Health, of course, that goes out and tries to, you know, regain those clients, and that, you know, reassure them that we have medication for them, whether they can afford it or they can't afford it, different stuff like that. But sometimes those things don't happen.
Yeah.
So that's the hardest part, knowing that someone is out there, and you had them face to face. However, they just seem to vanish because of the problems and tribulations that they're going through, and they don't want to accept the fact that they either contracted the virus or the fact that they can actually receive help.